Well, good morning, everyone. It's about a little after 11:30 and we can get started. I think we still have a few people popping in on the screen, as you all can see, as I do. And I want to welcome everybody. I'm Meg Disler. I am the director of the St. Joe Community Health Foundation, and we have the privilege of facilitating the Prenatal and Infant Care Network here in Northeast Indiana. I also thank all of you because it looks like it's going to be a beautiful day today. And I think as we're working our way out of this pandemic, it's hard to sit through another Zoom meeting. But so thank you for being here. We will be recording this meeting because we have found that about 40 or 50 people find each time we'll go back and review these comments. So I do want to let everybody know you are being covered in the video, and it's great reference material, and we'll be sending out a follow-up after this. With that, I do have a few housekeeping requests. We will ask everybody to mute your mics if you are not speaking. That just helps keep it removes all the background noise, as you all know, as I think everybody's pretty proficient with Zoom. The other thing I'm going to ask you to do is please put your name, organization, and any announcements about new programs that you have in the chat box. We won't go around and try to have everybody introduce themselves, but it's always very nice to see the names. Again, you can do your title or your organization and any program announcements in the chat box, and that will help everybody see who's on the call very quietly and help us keep building a network for referrals. So today we want to talk about the whole topic about safe sleep, with that data around it, sudden unexpected infant deaths syndrome, and we really have some amazing professionals here in Indiana working on this issue and getting good results. With this talk, we're going to start with Dr. Nancy Swigonski. Dr. Nancy has her MD, her MPH, her MBA, her FAAP, and is a professor of pediatrics for the Indiana University School of Medicine, Fairbanks School of Public Health. Now, with that many degrees, I could be talking about her for the next 10 minutes, but what she has to say is more important but as Dr. Nancy has shared that she's going to be retiring later in the year, I would say that nobody else do I know who has earned as many degrees as she has and still have, I think, surpassed the length of your last name, Nancy. And so today she has some really great information for us on Indiana's sudden unexpected death statistics. She has a lot of information on the survey data of parent knowledge and behaviors around safe sleep that can help all of us know how to talk to parents, train and educate her. Following her talk, we're going to have you hear some brief reports on some great work and projects going on in the Allen County, Northeast Indiana area to further help educate parents and to help us basically eradicate unsafe sleep in Indiana and in our community. So with that, I'm going to turn it over to Dr. Nancy to please open us up.
Thanks so much, Meg. I think really what she was intending was a forewarning. I am a data nerd. And so what you're going to see is lots of data in the next few slides. I sort of changed things around the way I usually present. And that is I usually present the data and then come to a conclusion. But for people who aren't as nerdy as me, I actually put the conclusions kind of first, and then I'll show you the data. So we'll see how that works. I'm going to share my screen here. All right, so safe sleep, what do the data tell us? So we're going to jump right in. So this, in general, not just for safe sleep, but the state infant mortality rate is improving. However, we continue to see racial and ethnic disparities, and frankly, our infant mortality rate is too high. So these are the data that show that, and I've got your faces right in the place where I want to point. Can you guys see my pointer? I think you can. I'm moving it around. Okay. So what you see is really for the last 3 years, we've trended down in terms of infant mortality. Nationally, they've also trended down, but our slope is a little steeper, meaning that we may be improving a little bit faster than what what we would be expected just from the improvements overall, which is good news. The bad news is look at the difference here. We're still at least 25% higher than the rest of the country. The disparities we continue to see. And so the bad news is Black infant mortality rates are still almost twice as high as white infant mortality rates. But the good news is that for the second time in over a decade, the Black infant mortality rate is a little less than twice as high as the white infant mortality. So at least we're trending again in the right direction and hope to see that continue to improve. So we're too high overall. 527 babies died in 2019. And just a reminder that 2019 is, of course, the most recent data. Infant mortality is measured through the first year of life. So the babies in 2019 had to turn 1 in 2020 in order to calculate that infant mortality rate. And it's now 2021, so we have some early data for the 2020 cohort, but again, the complete data is all from 2019. But 527 babies means it's 1 to 2 babies per day, or 1 baby every 17 hours. And what I tell people is that on average, by the time you wake up tomorrow morning, another baby in Indiana will have died. So what do the data tell us? If we could bring Indiana just down to the average, not even the best, but the average of the US infant mortality rate, then we would actually see 74 more babies who live to see their first birthday. So this isn't even being best in the country. This is being the average in the country. And that translates again into 1 baby per week or more would be safe. So what do data tell us in Allen County? Well, Allen County still has some of the highest disparities in terms of racial ethnicity and in zip code. So when we look at the data, because we're looking at zip code and county level data, we have to aggregate over years. So this is aggregation of 5 years of data. When you look at the non-Hispanic Black infant mortality rate in Allen County, it's 14.7, so one of the worst in the state. When you look at the Hispanic infant mortality rate in Allen County, it's 9.1, and that's in comparison to the state's Black infant mortality rate of 11 and the Hispanic infant mortality rate of 6.4. When we look at geographic disparities, 46806 was the second worst in the 2012 to 2016 cohort. And I especially want you to note the Black infant mortality rate, which was, when we think of third world or developing countries, this is as bad as what we would consider a third world country. The good news is this has improved. right? Still not where we want it. And actually still, when you look, the state puts out the 13 top infant mortality rate zip codes in the state, and 46806 still made it in the top, but markedly improved. So again, moving in the right direction, but we still have work to do. So what else do they tell us? Well, the improvements in the infant mortality rate were due to changes in perinatal risk, not to SUIDs. And the disparities in the SUIDs continue, but again, are improving. So when you look at the cause-specific infant mortality rate, what we see is, again, that 25% of the deaths, so 1 out of 4 deaths in Blacks in Indiana is due to SUIDs, or sudden unexpected infant death. In the non-Hispanic whites, it's 18%. So SUIDs overall accounts for 1 out of 5 deaths. And I didn't define SUIDs because I know we've talked several times with this group before, but sudden unexpected infant death is a death that happens suddenly and unexpectedly in an infant less than a year of age, for which there is no immediate obvious cause. So let's look at the causes of things that are categorized as SUIDs. And again, what you see overall, unfortunately, is that our rates have been climbing. We had in 2018, we dropped down a little bit, but really right back up for 2019. And what we see in the rates is there's 3 categories. So accidental suffocation and strangulation in bed, which has tended to come up, which people think is mostly due to case finding. We're doing a better job of assessing what causes these sudden unexpected infant deaths. And the SIDS rate looked like it was kind of coming down as the accidental suffocations went up, but then continues to climb. So SIDS is defined as after a thorough workup, right? So an autopsy, a death scene investigation, histology, doing cultures, all sorts of things. We still don't understand the reason for the cause of the death. Unknown is the 3rd category that fits into SUIDs. And unknown basically means the full workup wasn't done, so we can't assign it to either of these cases. All right, so accidental suffocation and strangulation generally falls into 3 things. Soft bedding, where the infant's nose and mouth are covered with bedding. Wedging, which means a baby is trapped between 2 surfaces. And the 2 more common areas that we see this is in a bed that's adult bed that's up against the wall, or on a couch or an armchair. And then overlay when somebody is sleeping with the baby in an adult bed and they roll over on the baby. So what do the data tell us? Really, the triple risk model of SIDS is still the leading explanatory model for things that aren't obvious: accidental suffocation and strangulation. So what is the triple risk model? It was really defined actually in 1994, so quite a time ago. But basically what they said is there are 3 things that overlap that have to occur in order for an infant to die of SIDS. Okay, and I'm going to walk through each of these and the data to support them. So the first is really a critical time period. And what we find, right, is SIDS occurs in the first 12 months of life. And actually most of SIDS occurs 2 to 4 months of age. And in Indiana, the 74% of Indiana SUIDs, or sudden unexpected infant death, occurred between 1 month and 5 months. If you actually add in the additional 10%, 84% occurs between 0 and 6 months. So it's that critical time period that people think is related to developmental issues, such as how strong is a baby and able to lift their head up if they start to have something starts to hinder their breathing, right? Also, how sensitive are they and their brainstem development to the response to hypoxia, low oxygen levels, and increases in carbon dioxide. So the other thing that has to happen is not just the critical age or time in development, but intrinsic factors. So people have really looked at this and tried to figure out, are there things like brainstem abnormalities? And in some cases there are, but it's pretty darn rare. The other thing people are really looking at now is cardiac abnormalities. And again, sometimes there are, but again, it's pretty rare. Genetic, same thing, sometimes, but it's rare. But I really want you to focus on prematurity and intrauterine growth retardation. So premature and small babies are more at risk. Again, may have to do with developmental outcomes. And then the other thing is really prenatal smoke or drug exposure, okay? And I really think people don't think a lot of time about cigarette smoking later, causing all sorts of problems. But what we really are finding in this whole new field of something called epigenetics is that exposures to toxins, such as smoke, actually cause problems and changes that influence outcomes when the fetus is exposed to them. So prenatal smoke exposure, not just postnatal exposure, is in fact associated with SIDS. So how are we doing in Indiana? So in Indiana, we have 8.2% of the births are low birth weight, 10% are preterm. This is pretty even with the national averages. It's interesting in Allen County, there's probably the same statistically, the 9.6% are preterm, but babies are a little bit more likely to be born low birth weight. When we look at smoking, Allen County actually does a little better than the rest of the state in terms of smoking. And over here, I put it in gray, not because it's not important, but these are risk factors for SIDS. And breastfeeding is, in fact, a protective factor. And the S means that Allen County, in fact, is doing significantly better in promoting breastfeeding. Significantly worse, because this is not breastfeeding, than the rest of the state in promoting breastfeeding. All right, so these are data again on women smoking during pregnancy. We have some disparities with Hispanic being the least likely to smoke, the non-Hispanic Blacks, the second least likely to smoke cigarettes, and then the whites, non-Hispanic whites, having pretty high levels of smoke, and in fact, much higher than the national rate. All right, so here's the third thing that has to happen is you have not only a critical period of time, you have something intrinsic to the baby that isn't totally understood, frankly, right? But prenatal exposures, something going on in the growth and development of the baby before they're born, and then extrinsic risk factors. So these are things that are happening outside for which we hopefully have some control. And you'll see many things that we've talked about previously in this list. So let's go through the data. Oh, you get the bottom line again first. So we know that prone or tummy sleeping puts you at higher risk for SIDS. Soft bedding puts you at highest risk for sleeping. And these two things remain the most common risk factors for SIDS. So how do we define a safe sleeping area? And this study actually, we think of these data and this information as being old, and it is because we've known it for quite a while, but people continue to study it and report it. And in fact, this data just came out in Pediatrics, published, maybe 3 weeks ago now. And they defined a safe sleep environment as one where the infant was found supine on their back, on a firm sleep surface, in a crib, bassinet, portable crib, or pack and play. And that the sleep surface was free of soft objects, loose bedding, bumpers, oops, didn't mean to go there yet, bumpers and any other objects that could increase the risk of suffocation, or I'm going to add here, rebreathing the air of the baby. So that's a safe sleep environment. So how many of the babies that had sudden unexpected infant death, what percentage of them were actually found in a safe sleep environment? Can we put things in the chat real quick? Get some guess? Because I'm showing my slides, I can't see the chat. So if somebody could read out some of the numbers.
All unsafe sleep positions is one. Another one is 25%.
All right. So the all was closest to the answer. In fact, what we found, or what they found, was that only 1% of this study of almost 5,000 deaths found that there was really no unsafe sleep factors and it was unexplained. So again, very rare when babies are sleeping safely as defined here, do we find SUIDs occurring. What about Indiana data? These are actually from the 2015, which is the latest statewide child fatality review. And what they found was there were 4 babies for whom they couldn't tell, but 2 out of 99 had no unsafe. 99 had the unsafe sleep factors. And it's not really just simple math, right? So a baby who sleeps on their stomach has 5 times greater risk of SIDS. A baby who sleeps on soft bedding has 5 times greater risk of SIDS. But if they do both, they're both on their stomach and in soft bedding, there is a 21% times higher risk of SIDS. All right, so here's some, does the work that we do make any difference? I think is one of the questions. And we had developed some surveys that we were doing with our Childcares in Marion County. And basically having our childcare providers as trusted sources of information talk with families about safe sleep. And so we had data that was meaning we hadn't worked with the childcare providers yet to do this. And then after we gave them some information and some tools to work with the parents. And so what we found was that, and so these are 2 cross sections, different years, right? So one is in a group of parents 1 year where we hadn't done anything, and then the next year when we had done something. So the pre-pilot, is there ever a cushion, blanket, et cetera, in the baby's crib? In the pre, they said never 66% of the time. In the post, parents said 85%. So a significant change. To keep the baby warm at night, how many people recognize that the safer option was a wearable blanket? Our results went from 59% to 85%. And then how often do you use a wedge? Went from the never, which is the correct answer, went from 74% to 92%. So at least in knowledge and reports of behavior, we've made some real changes in terms of some of the things that we wanted to do. The news isn't all good though. So how often is there a bumper pad? We still see these, and we should not ever see bumper pads around the edge of the crib. So about 25%. I don't think it's something we focused on when we talked with our child care providers in terms of talking with the parents. And we still see a huge number of people that have the baby sleeping in an adult bed at least some of the time. All right, so we developed, and I say we, it was really Katie Lynch and the Marion County Public Health Department Safe Sleep Work Group, some information to help spread. And again, unsafe bedding is the leading cause of unexpected infant death. And you can do a QRS code here, and it takes you directly to the American Academy of Pediatrics website that talks about safe sleep. This one talks about all infant inclined sleepers increase the risk of suffocation. There's been recalls of so many things that were purported to be safe for babies to sleep in a more inclined position. And the Consumer Product Safety Commission basically has recalled so many of these because of babies dying, and basically talking about how babies need to sleep with their chin up. And once their chin goes down to their chest, their airway can become blocked. And again, this QRS code leads people directly to the Consumer Product Safety Commission website that talks about things that have been recalled because they're not safe. So again, looking at the extrinsic risk factors, I want to talk a little bit, Meg had asked me to talk a little bit about breastfeeding. And so bottle feeding is a risk factor. Breastfeeding is a protective factor in SIDS. So we really do know that breastfeeding offers an enormous number of benefits. What many people don't know is we don't know why, but it does reduce the risk for SIDS. It could be, people have hypothesized a lot of things, that babies that are breastfed actually may wake a little more often and not sleep quite so soundly. So when you think about SIDS and what causes it, hypothesizes is that babies somehow are sleeping too soundly. They're not waking up when they need to move or expand their lungs a little bit better. And so that's one hypothesis of why breastfed babies may be at a lower risk for SIDS. So let me go. So how are we doing in Indiana? The good news, of course, is that we've increased a bit in terms of breastfeeding. The non-Hispanic, the Hispanic families continue to outperform everybody else. We're increasing with non-Hispanic whites, and non-Hispanic blacks continue to increase. So still disparities in the rates, but walking in the right direction. So I thought I'd put up this map, and you guys can see that you guys are close to the average of the state overall. That's in the yellow, but there are areas in our state that really have, honestly, very poor rates of breastfeeding. All right, so some people talk about, yes, breastfeeding is protective, and therefore we can do bed sharing when the baby is breastfeeding. So there have been studies that have looked at this. And again, you can't do a randomized controls trial, with, you know, the strongest kind of study design. But what they've looked at is risk factors when babies are in the bed with parents. And this study showed that when neither parent smoked, again, smoking is a risk, and babies were less than 3 months of age, they were breastfed and had no other risk factors, bed sharing was still increased the risk of SIDS by five times. Okay. So what do we do? Because we know that when you're breastfeeding, you're oftentimes exhausted. Oftentimes people do fall asleep with their baby at the breast, even though they may try not to. So how do you work with families and do risk reduction, right? Because we want to be, you know, we want babies to be as safe as possible, but we also have to deal with the reality of families and babies in our lives. So the American Academy came out with a relatively new statement that says, no, we have to acknowledge that parents frequently fall asleep while feeding an infant. And so really, to make feeding safer at night, what could you do? So one is, don't feed in a sofa or an armchair. We talked about that if you fell in between, you could do the wedging and it would really be unsafe. So do go ahead and feed in an adult bed, but no pillows, no blankets, no sheets. So get rid of all the soft bedding that's around you at the time you're breastfeeding. And if you fall asleep while feeding the infant should be placed back into their separate sleep surface as soon as the parent awakens. We do know that the longer the amount of time the baby ends up in the bed with the parent, the more risk that baby has. So don't beat yourself up if you fall asleep. Make it as safe as you can. And as soon as you do wake, get your baby back in that safe position. So this is a website that I'm encouraging everybody to go to now. This is really talking about how do we address the problem and do we have a new approach? So we used to, you know, we went through back to sleep, then we went to safe to sleep. We dropped from the 1994s, we dropped the sudden unexpected infant death rate by 50%. And then guess what? You saw in Indiana and nationally, we're not making any progress. And in fact, we may actually be increasing in our SUIDs rates. So we need to do something even more beyond just saying back to sleep. And so this is really a great website to help you learn how to have conversations with families, how to really give them information without making them feel judged, how to do things like if they say, well, I want to sleep with my baby, and they're not going to change their mind, rather than trying to argue with them, giving them the information that they need, that there's 5 times the risk. There are things that you can do to make it safer, although it's safest for the baby to be in their own space, and make recommendations about not having that soft bedding in the bed, not having anybody who smokes, obviously not any drinking or drugs if the baby's in the bed with you. So I love this website. They have some wonderful modules that you can go through, and as well as some tests to test your knowledge about safe sleep. And I think that's all. I hope I left a little bit of time for people to ask questions if they wanted to, and I will stop sharing my screen.
And if you have questions, if you come to you as we go forward, please feel free to put them in the chat and we will kind of come back around to those at the end. If you have an immediate question, please feel free to unmute yourself and ask it. There is a request to you for the website link that you just had said, Nancy. If you could put that in the chat, that would be very helpful to people.
Sure. Be happy to. And I think, I think Meg will send you a PDF of all my slides, so you'll have it on there too.
So following there's a lot of great information here and some additional. We'll be sending that out to you all with links to it. It'll also be up on our website within about a week or two as a copy, as well as a copy of this video. So you can go back and reference it more accurately and find the information. Marlee Case, everyone, is a pediatric practice specialist with IU School of Medicine. And she will share with all of you guys how Allen County agencies can do like what's being done in central Indiana, collect information along with free crib distribution on safe sleep education, what they're doing in this area and how we can participate. Marlee, I'm going to let you feel free to add on to your expertise and what you can share with people.
All right. Well, hopefully everyone can hear me, and please let me know if you can't. I know my voice fades out sometimes. I will start off by saying I absolutely love infant and helping keep infants safe. I first learned about specifically safe sleep and femur work while working in childcare, and then really understood just how important it was after working for the femur team through the Monroe County DCS. So coming onto this team and really understanding how we can help improve that process and really make it a collaborative process with parents has been very exciting for me. And the data, much like Dr. Swigonski, I love the data, because what the data does is tells us that we're either doing something right or we're doing something wrong. And it allows us to start asking those questions. How can we do better? Or what are we doing right? So I'll go ahead and get that PowerPoint up there for you. Okay. So how and why do we use the data? At least in Marion County, we utilize our data to ensure that our efforts are focused on the populations that would most benefit from our services. For our specific team, we focus on the top 13 infant mortality zip codes, and we really focus on making sure that our efforts are in those areas. While we don't disqualify individuals from different zip codes, the more that we can get cribs and tangible materials and education into the spots that need them most, the more we feel we are actually hitting the parents that need it. In addition, when the data doesn't match what our goals or expectations were, we're able to identify those barriers and potentially improve that system. For example, when I first took over the data piece, there wasn't really a centralized way to ensure that I was getting the data from all of our partners. And I very quickly realized that there's something wasn't streamlined. And so very quickly I was able to say the data isn't matching what I think is happening. And I was able to go in, kind of dig around and realize that I was just not getting all of the numbers that I was supposed to be getting. And so we reached back out. We found a way to make the process more streamlined for all of our partners. And we came back and it's been fairly seamless since then. The other important thing I want to point out is that the more data we are able to work from, the more reliable our results are. These results help either inform or take away from our hypothesis and allows us again to adjust what we're doing as a team to help make sure that we're moving forward in the best possible way. In Marion County, our partners mostly utilize these specific points of data: mother's birthday, baby's birthday, zip code, and race. Mother's birthday helps us understand the ages that we are working with. Baby's birthday, more so in Marion County, helps because one of our goals was to try and get a crib to a baby before it's born within those last 36 to 40 weeks. We really want to just speak the baby's birthday so that we know that we are getting as close to that as we can. But also it helps us understand if a baby's not getting a crib until they're 12, 14 months old, what is going on there too, that's what's happening for that family. Obviously zip code is important because we want to make sure that we're hitting the correct areas. And then race is important because a lot of this work is based on racial disparities. And we want to make sure that if our efforts are focused on a certain population, that's the population that we are focusing on. As the data is entered, reports are automatically generated on a regular basis, and I distribute them back out to partners. While these are some of the data points that our partners in Marion County find most important, that doesn't mean that your sites have to use those same data points. You are more than welcome to reach out to me, and we can collaborate about what things you think are most important for your site or to help move your project forward. And then from there, we can make sure that you're getting those reports as we see appropriate. So I went ahead and added I have been getting a little bit of data. So the pieces of data that have been complete, I went ahead and entered and did a couple quick maps and graphs for you guys just to give you an idea of what it looks like. And so for the very first one, this is your distribution of safe sleep kits throughout Allen, well, we're saying Allen County, but everything kind of associated with your PIC network right now. And so when I look at this map, I see that not only do you have a very wide range that you're giving out pack and plays, but I see that in Elkhart County, specifically 46516, that's so far where you've given out the most materials. I don't know much about Elkhart County's infant mortality rate off the top of my head, but it leads me to believe, is that the zip code with the highest infant mortality? What is the zip code with the highest infant mortality? And how can we ensure that we're reaching the individuals within those zip codes? This next one just shows you the distribution of cribs by month. At least for me, last year it was really helpful to know that we gave out almost no cribs in October and November. And then December came around and we had tons of requests for cribs. So it led me to ask, what's going on that we need more cribs? And then I very quickly found out that shelters were having to move families out of spaces, and all of those infants needed cribs. And so we were able, as our program, to step in and provide a substantial number of pack and plays to homeless mothers and their infants. Again, this also allows you to go, okay, in February, we only gave out one crib. What happened that we were only able to give out one crib? What were the barriers? How can we potentially do something different so that next time we're able to keep those numbers up and continue to distribute in an equitable way? This last one kind of breaks down how the cribs are distributed based by mom's race specifically. And as you can see, it really helps us understand which demographics we're hitting as we're going out into the field and giving these pack and plays. It also allows you to say, if part of your initiative is to ensure that you are specifically working with Black families to get cribs and get safe sleep education, then this will help identify whether or not your workers are doing exactly that. It also helps to understand if one of your goals is to have equitable distribution, are you doing that as well? So really, it just depends on what the goal of your organization is and in terms of how you can utilize the data. And then, thanks, Nancy, that's back to you.
Thank you very much, Marlee. And anyone who would like to participate in this, Marlee, if you, by providing data, could you add your contact information in the chat, please? Or reach out to us in the PIC network, and we're happy to connect you with Marlee as well. This is a great opportunity and resource to get feedback on program effectiveness. I now want to introduce a very special project that I know St. Joe has had opportunity to help support at the Parkview Miro Center. And so I'd like to introduce Lisa Clemens and John Lozo. And by way of a little bit of introduction, Lisa is a physician assistant by training and has worked clinically as a physician's assistant in cardiovascular surgery and emergency medicine since 2010. She took on a part-time clinical educator role for the health system in addition to her clinical duties in 2019, and transitioned to the Miro Advanced Medical Simulation Lab team as a provider simulation specialist in 2020. She really enjoys that balance of working clinically in the emergency department and also in education through the simulation lab. So I think she has a lot to share with us in that regard. Joining her is John Lozo. He is a healthcare simulation specialist with 5 years of operational and debriefing experience at Parkview. Prior to this, John gained clinical experience in the ER as a technician for 4 years. He's also the Miro Center specialist in 3D printing and has been heavily involved in the Safe Sleep Project's technical development. So I'm going to turn it over to John and to Lisa to please explain this really kind of exciting research you guys are doing that could really help a lot of parents better understand safe sleep.
Yeah, sure. We're going to share our screen. Thanks so much for that intro. There we go. So we're going to just give you a brief overview here of our Safe Sleep toolkit, which we kind of designed to be an adjunct to current safe sleep education that your team may be providing. So despite current efforts surrounding commonly used safe sleep education, such as brochures and handouts, our infant sleep-related death numbers in the US have remained fairly stagnant since about 1999. So non-adherence to safe sleep practices continues to be a significant risk factor for infant death. So research has shown over time that decisions not to follow safe sleep guidelines can often stem from caregiver beliefs and safety misconceptions. So we're going to kind of delve into that health belief model a little bit with this program to help identify why some of our current safe sleep education programs aren't actually increasing our adherence to safe sleep practices and situations. And just kind of a quick chart here, this is national. But we see that nice decrease in SUIDs and sleep-related death from about 94 to 99 when the Back to Sleep, Safe to Sleep campaign came on board. We've kind of leveled out. So as everyone else has said previously, begs the question, why? And what educational approaches could we potentially take or change to help move the numbers? So the Journal of the American Medical Association has identified that current public health education strategies are not effectively decreasing our US rates of infant sleep-related deaths. And they actually published an article in 2018 that included a call to action to think outside of the box. So they were just calling for some innovative approaches to safe sleep education. What could we potentially do differently? So perceived susceptibility, perceived severity, perceived benefits, and perceived barriers are all kind of concepts of that health belief model that I mentioned. So this is a community health education model, and actually the model that we built this educational toolkit on. So, we know that simply providing a crib or bassinet, brochure, video to a caregiver, if that isn't combined with, really effective safe sleep education, hasn't been shown to actually ensure that those safe sleep practices will be followed once we leave. So the health belief model in our safe sleep education program really tries to emphasize the susceptibility of infants to sleep-related death and poor outcomes associated with unsafe sleep. So kind of emphasizing the severity of placing infants in unsafe sleep positions. So I like to equate this to the Don't Text and Drive campaign, because I think a lot of people have heard about it and, they black out drive and it says die. So in that campaign, they're doing something similar. They're trying to emphasize that if you text while driving, you are susceptible to getting in a car accident and potentially dying. The result of that would be severe. They're not saying that every person or every time someone texts and drives, they automatically get into a car accident and die. They're saying it's possible. So similar with safe sleep, we have a lot of caregivers who say, well, I've placed previous children in these unsafe sleep positions, or my grandmother used these unsafe sleep positions, they're fine. Or even the same infant, I've placed them in these sleep positions, they sleep on their belly, they've been fine so far. So what we're really trying to do is emphasize that just because they've been fine so far doesn't mean that they're not susceptible to these severe outcomes, pneumonia, hypoxia, brain damage, or even death in the future. So that's really kind of what we're trying to emphasize with this program. So we've identified that we do need kind of a hands-on interactive approach to allow caregivers to not only hear about safe sleep practices, but they would see demonstrations, physiologic changes of both safe and unsafe sleep, and then interact with the demonstration staff. So this interactive portion and really the experiential learning component, because in simulation, that's what we're all about, is what's driving home to those caregivers why we're telling them what we are. So they need to understand why their infant is at risk in these unsafe sleep positions. And really that understanding of why is kind of what we hope makes this program a little bit different. So with our Safe Sleep Toolkit, participants not only receive safe sleep information, but they interact hands-on with the demonstration to help understand what changes can occur in their baby's airway in different sleep positions. So our goal again is that understanding of why the recommendations exist will help emphasize the importance of actually adhering to the safe sleep practices once we leave, and they are making that decision on their own. So we tell caregivers safe versus unsafe sleep practices, but often struggle to kind of get their buy-in. And so our goal is if we can show them and use these models and really help them to understand and see, we're not just telling them, they're seeing what happens. They're going to be more likely to adhere to those recommendations at 3 o'clock in the morning when the baby's been crying for hours and they just want the baby to go to sleep. So you can see in this picture here, the baby on the left is sleeping on his belly. There's a blanket in the pack and play. He has an oxygen saturation level on that monitor of 79%, and this is a mock monitor. So this is our expensive simulation equipment. We're not saying every baby who sleeps on their belly has an oxygen saturation of 79%, as we saw in the previous presentations. Kind of all of those factors combined can cause this, but it could happen, similar to the Don't Text and Drive campaign. You might be okay, but it could happen. The kit also includes anatomically correct 3D printed models of an infant trachea and esophagus, and we have those filled with simulated vomit. So that's to demonstrate when an infant vomits on their back, it's actually more likely to drain down into the esophagus, but when an infant vomits while on their belly, it can potentially drain into the trachea, impair breathing, lead again to hypoxia, pneumonia, sleep-related death. So we're not just telling them and trying to address that misconception that they're, about vomiting on the back. They can take this model and interact with it hands-on, move it around and see for themselves. That's kind of the cool thing we think about the program. Our goal with those original ideas, very expensive equipment, we wanted to come up with a way that we could get this into the hands of safe sleep educators anywhere. They wouldn't need to have, this really expensive simulation equipment to provide this education. So we discussed with our safe sleep educators some improvements that we could make to that original idea, and kind of made this kit, which includes a model that more closely resembles an actual infant. And also we kind of simplified the monitor down. It doesn't have a heart rate, it doesn't have a rhythm. All you're seeing is an oxygen level in the different sleep positions. So the 3D print model allows the educators, again, to address misconceptions regarding vomiting, infant vomiting in the back to sleep position. And then the mobile application is what allows an educator to just pull up this mock monitor on their phone or an iPad, and it essentially turns their screen into that monitor that we were previously using that really expensive simulation equipment to display. So we don't need that anymore. Anybody can use it. So the educators can use a doll in combination with the app, and place it in the adult bed and say, this is what could happen. They can place the patient prone or the doll prone in a pack and play, select the associated position and see what happens. So that's kind of our goal. And then you can see there in the picture a screenshot of the app as well as the refined infant model. And the app again, was intended to display the oxygen level, you know, associated with unsafe sleep positions. And we are continuing to kind of improve that as we get more feedback. And some people, I'm going to try to share here, quick video. Some people are just going to go ahead and use the, you know, that 3D model if they don't have a baby doll available, and that's totally fine too. Here, I'm just going to fast forward just to give you a quick glimpse of what that new infant model looks like. Yeah, we'll make it bigger. So looks more like a baby, made of a soft silicone. And that was after feedback from our community health workers. They said, you know, people are going to dissociate if this looks so anatomical, make it look more like a baby. So that 3D model is now inset into the baby. You can provide the same education with the model inside the baby, you know, vomit on their back, flip over, you can see where the fluid goes. Again, some would come out of, you know, you have an oropharynx there, some will come out of the mouth, but there is that potential for fluid to drain down the trachea into the lungs. So you could go ahead and pull that insert out, hand that to them, and you know, really try to emphasize and get them to understand what's going on. Let's see if I can get rid of this now. There we go. All right. And so our pilot program that we received funding for through the St. Joe Community Health Foundation is a collaborative effort, both with Parkview Women's and Children's Hospital, as well as Healthier Moms and Babies. So both of these groups are serving low-income individuals, and our goal is to implement the use of the kit in addition to their standard education on a local level and study the outcomes associated with the implementation. So our community health workers are verbally surveying caregivers at home visits before adding the Safe Sleep Toolkit and providing that educational intervention. And then they're being surveyed again at 1 month and 3 months after the intervention. So we are using a verbal survey format because we didn't want to exclude any non-English speakers. So, you know, kind of translator piece is taken care of. And then our community health workers are also tracking observations of sleep positions during their home visits and any interventions they've had to make to correct or change sleep positions while in the home. So the pilot was delayed due to COVID, but our staff is very thankfully getting back to a more normal education style with clients in the home setting. And this pilot is actually going to wrap up in December, and we should have some really helpful data to report after that time. And I am just going to quickly give you a picture here of the mobile app. I'm hoping you can see it here, but this is set to the normal setting that you saw in that screenshot. So then if I click like on stomach, you can see the background turns to red. We have that alarm tone associated as well, just to kind of appeal to both the visual and auditory learners and really help that point to hit home. These are our references for this particular presentation. And if anyone has any questions or would like more information, definitely feel free to reach out to us. And yeah, and we'll put our info in the chat as well. Thank you.
Lisa and John, exciting work. Thank you. In the interest of, and I would ask one other thing, if you wrap up at the end next year, we want to have you back to share with what you've learned out of the pilot and how we can all participate and go further with what your research is taking us. So thank you very much.
Thank you.
Next, I'd like to introduce Myla Rogers with the Early Childhood Alliance. She is on a pretty ambitious project on teaching safe sleep to childcare providers. Myla is a quality improvement supervisor at the Early Childhood Alliance by title. And so she is responsible for the quality improvement of their childcare programs and has been working with the Marion County project, bringing it to Fort Wayne in this area here with a lot of her expertise in how do we better equip local childcares in, actually, I'm going to let her explain it a little bit further, and you're going to hear the detail on that. I do want to say that she has had over 25 years experience in childcare and has worked in a whole range of positions in this area. So she understands the challenges of those childcare teachers, the center directors, the visiting home caseworkers, the managers, and really can help them, equip them who are on the front line of working with many of the parents who for the first time are dealing with safe sleep, how to care for their infant. So with that, I'm going to turn it over to Myla Rogers to talk about the Early Childhood Alliance's project on teaching safe sleep in early child cares. Myla?
Good morning, everyone. Hopefully you all are having a great day today. I want to first say thank you, Meg, for this opportunity. And also thank you to Dr. Swigonski for entrusting me with the support of the Allen County project. I will first say that the Allen County project didn't originally start with Early Childhood Alliance, but I was supporting with another agency, Healthier Moms and Babies, and they actually helped to get this project on the ground and moving. With that first year of the project, we were able to support a lot of programs in Allen County. If we can start out with the slide, I have a couple slides that I have on here, and I'll just you can move to the next one. And again, this project is in collaboration with the Marion County project also. So our focuses are on decreasing the amount of safe sleep deaths in this area with the highest needs in Allen County. How are we doing that? By providing safe sleep materials to providers, increasing the number of infant slots here in Allen County, help providing providers increase in past quality. And what past quality is, this is the rating system for child care providers in Allen County. And then training providers to become safe sleep ambassadors. So those are ways that we are helping to decrease infant mortality in Allen County. Our target zip codes in Allen County are 46803, 05, 06, and 16. And as Dr. Swigonski said earlier, 46806 is has the second highest rate of infant mortality in the state. Now, this isn't a slide. I actually just received this information because as I was doing this slide, there was more information that I wanted to know about the 46806 zip code because it is has the highest infant mortality, second highest infant mortality rate in Indiana. And so I reached out to someone and they actually were able to tell me that in the 06 zip code, there are a total of 71 child care programs in the 06 zip code. Within the child care programs that are there, 62 child care programs are family child care providers. That means that they're not in center-based programs, but they are actually in family child care homes. Of the licensing capacity or the amount of children that could be in child care programs in the 06 zip code, 954, that capacity is 954 children. And then within that, family child care, the capacity for that zip code is 732 children. So we have a total of almost 1,000 children within the 46806 zip code. And that was just some statistics that I received, and I thought that was very, very interesting to receive that information. Also, the other programs, we have 2 licensed centers in the 06 zip code, and we have 3 child care ministries that are in the 06 zip code. So when you look at this, that's telling us that we have 62 small businesses, small family child care programs that lie in our most vulnerable, one of the most vulnerable zip codes in the state of Indiana. And so when I looked at that information, that means my job is very, very important when it comes to working on this project. Safe sleep environments. So when we are looking, when we're working with this program, we literally, when we are working with programs, what are some of the things that we do? We give the child care provider an overview over the project and how we can support them. One of the important things that we do is we assess the provider's current sleep environment for children. For child care providers, they are already required to take safe sleep as a part of their onboarding process for becoming a licensed provider. But with this project, and we'll talk about that a little bit later, when they want to become ambassadors, we have them to take an extra step. They're taking the training over again, and we're using Crips for Kids to do that because it specifically supports providers in having conversations with families about safe sleep. So we also discuss materials needed for a safer sleeping environment with providers. And even though some of them have knowledge of it, I've also been a past quality coach in the previous system, and we would go out and support providers with quality improvement. And although providers, and this is not all, although they knew the information about safe sleep, you would be amazed at how many times you would go into a program and you would find a child, an infant, sleeping in an safe way of sleeping. And when we were in those programs, we would literally have to stop whatever we were doing and have the provider to fix the issue that was going on, because we wanted to ensure that that infant or that child was safe. So we also, we go over those materials. We also talk about what their needs are, and we order materials that they need to ensure that they have a safe sleeping environment for those children. Some of the, of course, in that target zip code, we have a lot of family child care providers. So we had a lot of them that may have had old pack and plays or needed more up-to-date equipment for the children. So we would make sure that they would have those things. We would support providers in setting up the safe sleep environment. So after we order materials, we would go back and support them and then have more conversations with them to ensure that the safe sleep environment was happening. And then also follow up with providers to ensure safe sleep practices continue to be met. So Safe Sleep Ambassadors conversational tools. As you can see on the left is on the right is actually a picture of the different materials that come with the family engagement kits. Providers can advocate for safe sleep by becoming an ambassador, and Laura will talk a little bit more about the Sleep Safely campaign, because we are also supporting and creating ambassadors in the community. And so I'm also collaborating with the PIC network on that too. But ambassadors, the providers are ambassadors. They are advocates for the children that they have in their programs. They're advocates for their community that they live in. They are advocates for families that they serve. And so we want them, a lot of them may not realize that. And so with them becoming Safe Sleep ambassadors, it's giving them the opportunity to stand up and fight for the children that they're serving. Also giving them the opportunity to help empower families that they are working with. I know as a coach prior to this position, this was a hard conversation for providers to have with families. One, because it felt uncomfortable. Two, because sometimes those families had their own traditions of how their family wanted their children to sleep, or how they believed was the right way for them to sleep. And so this kit actually makes it more easier for them to have that conversation in the beginning when they are enrolling children, and then also if they have children and infants that are presently in their program, to have that conversation with families. Providers take the Cribs for Kids Safe Sleep training. Again, that helps them with that conversational piece with the families. Review child care parent survey and materials in the family engagement packet. We actually go over that with the providers to help them to understand or have easier ways to have conversations with the families. Providers receive a certificate of completion, and they're also given the community Sleep Safely flyer, which actually Laura will probably go over that too, and it's just an easier way to have a conversation in a consistent way to have that conversation. Making an impact. What are we doing as far as making an impact in Allen County? This project supports family child care providers through a learning community, which allows for infrastructure growth. So in our first year, as we were working and coming in contact with providers, the child care system had changed in the last 2 years, and the providers were really seeking out support because of the changes in the system, and wanting to know, well, who do I go to for this support and different things. So again, this learning community helps with infrastructure growth, professional development, collaboration with other child care providers, helping to set business goals, connections to other child care systems, and then child development certification, which is a CDA. It's called a CDA. And so again, it's building that professionalism within the providers and helping them know again that they are ambassadors for their community and that they have some input in helping to save the lives of the infants in their community. Thank you. Let me know if you have any questions.
Oh, thank you, Myla. Important work, as you shared. I'm going to jump quickly. And Myla, please put your contact information in the chat box. And now I'd like to introduce Erin Norton. Erin is the Director of Community Outreach for Parkview Women's and Children's Service Line and focuses her work on local infant and maternal mortality efforts. She's the Allen County FEMR coordinator. FEMR is Fetal Infant Mortality Review, and she's going to share some of their work. Erin, why don't if you want to see if you could figure anything out there, Laura, can we shift to you to
Absolutely. Absolutely. Because actually I have another meeting. So hi, everybody. I'm Laura Dwire. Do you need to introduce me, Meg, or can I
would be very quickly. Laura's been working with the PIC network for a while, and she also is the Healthy Start Program Director for Healthier Moms and Babies. And Laura, you can take it from there, what you're working on.
Great. Good to see you all. Yes, I've been in this PIC network for quite a few years. I consider myself your Sleep Safely champion because we embarked on a Sleep Safely campaign about a year ago, Meg, maybe a year and a half ago. And our real purpose of that campaign was to have a community-wide safe sleep message. So whether you're in the daycare setting like Myla, whether you're like a Healthier Moms and Babies in the home doing home visits, it doesn't matter. We just want everyone to know the ABCs of sleep. So what we offered was ambassador training, which is just simply if you take an online course, it's a free online course, and Mark can share that link with you. You print your certificate or you save your certificate, you send that to us. We will provide you with posters and also flyers. And so we have expanded that opportunity, and they have been translated into Burmese and into Spanish. And so you'll be able to have multiple languages in your area. So our vision is anywhere that a mother with an infant is, that they'll be able to see our poster or at least our flyers. So we're hoping for a baby's closet, Christ Child Society, everyone to have our big poster and then be able to not only hand out a flyer, but have a basic conversation around the basics of safe sleep. So.
Great. And Mark, can you share the posters that Laura's talked about?
And we got a beautiful baby model from Jackie Martinez who has twin boys. So, but she didn't tell me which twin this is. So as you notice, there's 6 steps on ours because we wanted to go beyond the ABCs because smoking we know is such an issue, and Nancy's data and everyone else's would tell you that as well. So this is the poster that you can get. And then the flyers will also be available as well to hand out.
And Laura, the flyers will be in multiple languages, as you said,
Right.
Spanish, Burmese, and in English. And we're just kind of finalizing all the infant photos at this point. So we will be getting that out to everybody, and you can have copies of these posters. And Mark, you can show where, if we need to, we can add their logo for their agency. The bottom. Thank you. So thanks, Laura. You are our Sleep Safely curriculum champion.
And sorry I have to jump off, but thank you, everyone. Have a great day.
Thanks, Laura. We're going to jump quickly back and with Erin and let her have the last word. She's got her volume now, and Mark you'll share screens. Erin, can we hear you?
Can you?
We hear you, yes.
Okay, okay. And in the meantime, I lost a screen, and it's good. Yeah, one of those days. Good thing I only have a couple slides to share, and I'll make it snappy. So in Allen County, our SUID rate, you can see, since the early 2000s has decreased. We haven't had these high spikes in quite a while, but we have not been able to get lower than 3 deaths in a year. And so we've got some work to do to really get out of this stagnation period. And I was able to talk to an epidemiologist at the Indiana Department of Health, and then from 2015 to 2019, we had a total of 20 SUIDs in Allen County. And if I go back a screen, you'll notice that it's 21. And so the difference there is that I got this data on this screen from the State Department of Health and the other data from Allen County Department of Health, and I think it's tabulated slightly different. Other than that, I'm not really sure. We're one off. But regardless, from the Indiana Department of Health, 11 of these deaths were among African-American infants. So 55% of SUID deaths in Allen County in the last 5 years were African-Americans. And so that really just highlights the disparity. And I knew there was a disparity. I hadn't realized it was quite that many. And when you look at it here, in our own backyard, it's just what really stands out to me. And then all the other races and ethnicities were suppressed due to low counts, where there were less than 5. And then, of course, keeping in mind, because these are such low numbers, that it's unstable. But I still feel like it's significant enough that we should share that and be aware of it. And then just highlighting our accomplishments here in Allen County. We know that any baby in Allen County who needs a crib can get one. There are multiple agencies who are providing cribs. It's something that there's not a reason that any baby who needs a crib can't find what they need. We also know that we've got a lot of community collaboration going on, and that we're getting some standardized education out there, reducing confusion among parents and caregivers. If we're all giving the same message, that message will be repeated, and we know it's the right message as well. And we also, thanks, as everybody knows from the speakers earlier, we've got a lot of innovation occurring here locally. And with Parkview's innovation project, I can let you know that they're talking to people at the national level, at the state level. Lots of people are really excited about these things. And it's something that's homegrown that we can be really proud of. And we've also had a lot of growth in home visiting. We've got doulas coming into our area and other services that are offering increased support to more families, because we know that there's really not any substitute for support. And then opportunities, we've got to work on this disparity problem. We really need to focus our efforts on the populations at highest risk, and we need to make sure that we're connecting families to these agencies that are providing cribs and education. It's one thing to have them, and it's another thing to make sure the families get to where they need to go. And we've got to make sure we're educating all of the caregivers, and that can include mom's boyfriend, who may or may not be the father of the baby, grandma, childcare providers, the 15-year-old babysitter, whoever it might be. We've got to find ways to reach everybody who's caring for baby, and then also seek out novel approaches to reaching the community. We know what we've done so far, and we've got really good efforts going, but we haven't been able to get below those 3 deaths a year. And so I think that's really our challenge, and I think we're up for that challenge. So sorry about my technical difficulties, and that's it for me.
Erin, great job. I think you have the last word, and I want to thank everybody for joining us. In about 2 weeks, we will have a synopsis of all of this and links to get to all this material, the recordings, the handouts, and all the references. So thank you all. Have a great afternoon.